new variant, should we be worrying at the current stage or should we not be worrying?
Even a smaller outbreak can be catastrophic. So this variant, which is now known as JN.1 variant, it is basically from the Omicron variant only. The problem is that it is troubling us. When the two deadly things go entering our chest. So any cough, breathlessness, sore throat, patient are complaining of congestion of the chest and fever not going, high-grade fever, please consult your physician. The COVID-appropriate behavior, which was a masking or a hand hygiene and social distancing, even WHO has said this is variant of interest. It's not variant of concern. However, who have not taken a vaccination or have not taken the booster shot, please go ahead and take it out. And who has not taken it in last 1 year, please take a booster shot.
Sponsored by Mother Dairy.
Hi, I'm Shreyasa Vijay and you're watching Ritam. It's been 4 years since the onset of first wave of pandemic, but the emergence of this new variant, JN.1, and the uncertainty around the disease suggests that COVID-19 pandemic is simply not over yet. The active number of cases in the country have reached over 4,000, with New Delhi now also reporting new cases. So today we have with us Dr. Sandeep Nair, who is a pulmonologist and a principal director and the HOD of Center of Chest and Respiratory Diseases at the BLK Hospital, New Delhi. Thank you for joining us, sir. Welcome to our show.
Thank you.
Dr. Nair, it's 2023 and this COVID-19 scare doesn't seem to leave us alone. So about this new variant, should we be worrying at the current stage or should we not be worrying?
Yeah, 23 and that's also going now. So
yeah.
It's almost, we are going into 24 and this COVID is not stopping bothering us.
Exactly.
Yeah, so this is, it's like any virus. It keeps on mutating, it keeps on coming back, it keeps on troubling us like most of the viruses do. So this variant, which is now known as JN.1 variant, it is basically from the Omicron variant only. The Omicron variant, if you remember in 22 really or 21, 22, it caused a lot of problem to us. And from there, we had a BA.2.8.6, which again caused a little bit of problem. It's the same variant from Omicron. And from their same lineage, we are now having a JN.1 virus or our strain. First of all, it was detected somewhere in Luxembourg in August 2023.
Yeah.
And then from there, it was detected in US in September. And now other European countries and Singapore and now even in Delhi. Delhi, the first case was detected in Kerala, and from Kerala to other states, and now even Delhi has reported a case. So the problem is that it is troubling us, that it is causing cough and breathlessness. But the good thing about it is not as severe as the previous predecessor. Delta was very horrible. Exactly. It was very scary, because it caused a lot of morbidity and mortality.
Exactly.
But this is not as bothersome as the Delta virus which we had encountered in the past.
So how this new variant is different from other variants?
So this variant is, just like any other virus infection. So this is the winter season in India, and we have many viruses prevailing since ages. You will have respiratory syncytial virus, you may have a bird flu, you may have a H1N1, H1, H3N2, and so many variants. So most of these viruses, they cause cough, fever, expectoration a little bit, but breathlessness, watering of the eyes, nose, and so this is also behaving in the same way. So at times it becomes indistinguishable. It's very difficult to find out what virus is really troubling us. And many of us are now not even getting tested the way we were getting it tested in 21 or 20 or 22 in the initial months, because we were scared of the COVID. So we are not even getting RT-PCR done now of all our patients, unlike in 21, 22 when we were getting it done. So probably many of them are just passing out. Maybe they had contacted infection and it has just passed out, and like most of the viruses, a self-limiting disease, and patient is fine and we are okay with it. So it becomes very difficult at times to really distinguish which one was other viral infection or a COVID-19.
So you are saying that COVID has reached that endemic stage and we should not be worrying about that much.
Yeah, it's nothing to panic, let me tell you honestly. Of course, even the mortality which we have seen in this strain also. So most of the people who have got comorbid condition, like people who have got otherwise heart condition or a kidney condition or any chronic illness, they are more susceptible to get a severe form of infection. Or those people who have not been vaccinated in past, they might get a severe form. But most of the people who are getting the infection are getting fine in a week's time or so.
So as you were saying that in winter season, people generally fall sick due to fever, cold and cough. So how should one differentiate or how should one decide whether they should go for testing or not?
So this is a tricky question because the symptoms are almost same. Patients will come with the cough, patient will come with sore throat, patient will come with the coughing and breathlessness. So many a times you don't even know whether we really need to test or not. We just give a symptomatic treatment because even by getting treated, getting tested, you're going to give them almost the same conservative treatment. So if you really think that patient is really sick or if you want to get tested, you can get that test done. Once it's positive, you still need to confirm with the RT-PCR to know which strain we have it, because as per the government, we have to do genome sequencing just to find out which strain we are dealing with it.
So for the general public who don't have any comorbidities or any other respiratory issues, so what precautions should they take? Is mask enough, or should they avoid going in crowded places, or what would you suggest?
So since this COVID is there, it has come to India also. It's better we take precautions. Precautions is always better than cure. So please, the COVID appropriate behavior, which was a masking or hand hygiene and social distancing, special for those who are prone for these problems, like who have comorbid condition and who are elderly people or very young children. So please, I would like to tell them that please take appropriate precautions so that you don't get this infection. And those people who are who not got them vaccinated, please complete your vaccination. So that is very important because this vaccine does prevent of getting infection, if not, but at least not get a severe form of infection. So this vaccination should be taken, if not taken.
वैक्सीनेशन को लेकर भी काफी कंफ्यूजन है अभी पब्लिक में. जिन लोगों ने ऑलरेडी वैक्सीन्स लगवा ली हैं तो उन्हें बूस्टर डोजेस की जरूरत है या नहीं, और बूस्टर डोजेस भी लगवा चुके हैं उनके अलावा उन्हें एक्स्ट्रा बूस्टर्स की जरूरत है या नहीं, उसके रिगार्डिंग आप क्या कहेंगे?
सो फर्स्ट ऑफ ऑल, जिन्होंने वैक्सीनेशन नहीं किया है तो प्लीज अपनी वैक्सीनेशन करो. इसका जो सबसे अच्छी बात है कि जो वैक्सीनेशन जिसने की हुई है वो ओमिक्रॉन को कवर कर रहा है, तो ये ओमिक्रॉन का ही वेरिएंट है. तो वी होप दैट दिस विल बी आल्सो कवर्ड बाय द सेम वैक्सीन, व्हिच इज व्हाट वी आर सीइंग इट आल्सो. सो इफ एनीवन हु इज बीन टोटली वैक्सीनेटेड, please still you have to take the precaution, but it's good news for you that vaccine does cover this strain also. However, who have not taken a vaccination or have not taken the booster shot, please go ahead and take it out. And who has not taken in last 1 year, please take a booster shot, because in case you have taken the booster shot, this is definitely going to help you by preventing the getting a severe form of disease at least. Or maybe you do not get the disease. Whatever vaccine is available. That's not that the Covishield is better or Covaxin is better. All are equally good. So whatever vaccine you have taken it, please take a booster shot if you have not taken a booster shot of it.
So booster shot is necessary for everyone, or like people, old age people or comorbidities?
For all of us it's important, and for comorbid condition and old age is all the more important. And now there's reports also that the mixing and matching of the vaccination has also been done. So it's not that someone who has taken, for example, in outside who were taking a vaccine, a Moderna vaccine or a Pfizer vaccine, and they have seen that a mixing of the vaccine has also been done.
Is that working?
It is working. So if it is, you've taken a particular brand, if you're not getting that, the other getting it, so probably that's also going to really work it. Because it's worked outside also. And I hope that whatever booster shot is available, please take it. It's definitely going to help you out in it.
Okay. As of now, Government of India is not taking any serious precautions or ऐसे lockdown जैसा कुछ situation हमें देखने को नहीं मिल रहा है. Even government ने ये भी कहा है कि we do not need to panic right now.
That's what. Even I say the same thing, that we don't have to panic. But even WHO has said this is variant of interest. It's not variant of concern. So there's a difference between the two. Variant of concern is a really panicky situation. You have to do all the precautions, etc. But variant of interest is that please take care, especially those people who are comorbid, that this might become problematic, but may not become a problematic, most likely. I hope it doesn't.
Okay.
So this is a variant of interest as per WHO. As per our Indian government also, they are giving advisory to take care, but there's no strict, you can do a lockdown or a masking mandatory or even a thermal sensor at the airport. It's not been done that much as of now because there's nothing to panic, fortunately, but we need to take all the precautions.
But the AIMS has issued new guidelines, and hospitals are also being told to stay prepared for any severity. This is enough for as of now, looking at the current situation, or should we be doing more things to so that we do not reach that horrible stage we were at in 2021?
Yeah, so we burnt our fingers during our Delta strain when we ran short of, not only we in India, we means all over world.
Yeah.
So we ran short of beds all over world. When we ran short of oxygen, because no one expected it to come like this.
Exactly.
And so this time we have been taking more precautions. We are more worried that even a smaller outbreak can be catastrophic. It can really become worse. Who knows? Though we still are optimistic that it's not going to be that bad.
Okay.
But at the same time, having said that, we must also understand that this might not give time the way it has not given time in 2021. So as a health professionals and as a government, we are ready to tackle in the case if it arises anything like this. But as of now, please don't panic. Just take precautions.
So we every time the new COVID variant arrive in India, we generally see that first case is mostly reported in South India. So why South India is prone to such diseases?
Yeah, well, that's a very important point because even the COVID which came, the initial was from Kerala.
Yeah.
And this time also JN.1 is from the
Kerala. Yeah.
So South, maybe there are more people who are coming from outside in the Kerala. We've got a lot of people from Kerala going into Middle East and working there, and then they are quite often coming out. As of now, the tourism is not stopped. The communication and we are still going out. The thing has stopped. So people are coming from all over world. The travel is still
going on. Yeah.
Good one. When in 20 or 21 we were testing almost all patients who were having cough and sore throat. But now we are not testing all of them because most of them are conservatively treated and again they are getting well. So we are not ordering RT-PCR in all the patients out here at least. So, but of course, wherever we suspected, we do test it to see we are not dealing with the COVID.
So this casual approach will be enough for the future?
We are cautious. We were taking precautions as of now, but it's not. We are not panicking. We are not causing alarm like that.
Okay.
So we may not be that strict the way we were in 20 or 21, that each and every patient was scrutinized and masking was compulsory in all over public places. So probably we are still thinking that this could be a variant. At least I hope so. It's just like a passing variant, and that might be curtailed, and it's not going to cause much harm. But again, those comorbid conditions, please take precautions.
So looking at the current mutations, the virus is continuously mutating itself. So do you think in future we can see more deadly or dangerous mutation, or that's it?
I hope we don't see any deadly variant because we've seen it in 2021. And I think we see many times these mutations are dying mutations also.
Okay.
So many of the times when the virus is dying down, it causes a few mutation and then goes away. So I'm hoping that way. And secondly, because now most of the population is vaccinated, at least in India, I must compliment our vaccination drive was amazing.
Exactly.
And we could cover, it's a 1.2 billion population country, and we have covered most of the people who are eligible for vaccination. And since the vaccination has been done, so we may not have the severe form of the disease, if at all we contact it also. So I'm quite hopeful that we should be okay to, get away with this virus. It's not going to cause any problem. But still, again, like I said, those people who are not vaccinated, please get yourself vaccinated.
Okay. Are there any specific symptoms that people should look out for?
So any cough, breathlessness, sore throat, patient are complaining of congestion of the chest and fever not going, high-grade fever. please consult your physician. And in case it is not going for 2-3 days, then you need to get tested.
Okay, so do you think that pollution also plays a role in COVID-19 impact?
So, this is a double whammy. The pollution itself is also attacking the lungs because if you inhale air, this is going to get our lungs get infected and get affected. And then the COVID also get into the lungs. So, when the two deadly things go entering our chest, so it's a tough time for all of us to tackle it. So pollution, of course, it is important that we must curtail the pollution as far as possible. Like in India, we already again had a grab thing going on because again the pollution has risen, and if it has gone above 300, 400, it means that AQI is really bad. So at least please curtail the pollution because this pollution plus COVID is definitely going to harm us more.
So आप जैसे पोल्यूशन की बात कर रहे हैं एंड कोविड के साथ में, तो लोगों को किस तरीके से अपने रूटीन में कुछ बदलाव करने चाहिए सो दैट दे कैन अवॉइड गेटिंग इन्फेक्टेड?
देखिए, कोशिश कीजिए कम से कम बाहर जाएं. जिनको नहीं जाना है काम पे जाना तो जाना है, जिसको काम पे नहीं जाना है, जो ऐसी ज्यादा जस्ट वांट के चलो लेट्स गो फॉर अ स्ट्रॉल और समथिंग लाइक दैट, स्पेशally the elderly people, please take a break. Even morning walks, we are not recommending to the people in this pollution.
Okay.
कि इस pollution में morning walk कोई इतना ज़्यादा नहीं जाना जरूरी नहीं है.
अच्छा.
अभी देखो fog भी set हो गई है, तो fog और smoke मिलके smog जो बन जाती है harmful होती है. So if you want to really go out for a walk, जो morning walkers are, they can go in little afternoon types when the this is less pollution is less, or at least if they really want to do exercise, we tell them to do it indoor, or at least you can go for a yoga.
Like yoga and breathing.
Yeah, yoga is very good. And again, the Prime Minister has done a lot for the pushing the yoga, and I'm really happy that many of my patients are doing yoga at home. At least it's a closed environment, but in those people also, I would like to tell them that please curtail your indoor pollution also, because indoor pollution by dhoop, agarbatti, candles, they can cause a lot of mosquito the coil, they can cause so much of pollution. So be careful about that also. So whoever is going out, if possible, go for carpooling rather than going individual car, because we have to curtail down the pollution. Use the public transport. We have got a public transport with us. They are using either electric buses or a metro where we can cut down the pollution. And as far as the COVID also concerned, avoid going into crowded places because there are more chances to contact and spread the COVID. In case you are not feeling well, if you are having symptoms, please don't go outside because you may give it to your other people around you. And even the children who are having these symptoms, please don't let them go to school because other children can catch it. So please take all the precautions.
There are also several myths around vaccination. बहुत सारे reports ऐसे आए थे कि vaccination is leading to heart attacks and all. So what would you say about that?
There were a lot of myths about the vaccination, but again, these are all myths. There's nothing true in it. In fact, we had seen a lot of patients having heart attacks with the problem of COVID, not with the vaccine as such. The patient had a COVID, it caused a lot of problem in lungs, heart, kidneys, brain, mental fogging is till date, post-COVID sequelae we are seeing it. So vaccination, no, very, very rare. If anything occurred, it's a different thing, but it doesn't cause any problem. So vaccination is absolutely safe.
Do we have any specific drugs for COVID-19 right now?
All the drugs which were used in COVID, they were basically kept on changing, if you remember, because initially they thought that hydroxychloroquine or chloroquine is going to work. It didn't work. Then they had other drugs.
Remdesivir and all,
So finally, with 2-3 drugs which showed working on the COVID was one of them is remdesivir, which you just named it. Other was baricitinib. They thought that is also going to help it, and they were almost approved for the COVID-19. Then there were some cocktails and all these things which were used to prevent getting severe form, but that could only be used in initial days. So remdesivir, of course, and again, these drugs should be used as early as possible. They don't work after 10 days of COVID. So if any patient who is really sick and whom you think that who is COVID positive, we do give remdesivir in these patients along with baricitinib. And again, till date, the best treatment remains a conservative treatment, a supportive care. We have to really support and care for the patient.
Okay.
And more than 95, 98, 99%, I would say, will they recover on their own.
Okay.
Especially these strain which has come now, hardly need any treatment. I think more of conservative treatment is good enough.
Are there any kind of home remedies that work on this?
Now, home remedies, there have been many. If you remember, they talked about Kara, whom they started giving it, but it had not shown any scientific support in
Okay.
it. So just rinsing your mouth or rinsing your nose or doing jal niti might help to some extent, but there's no scientific proof as of now that home remedy really helps. I think we just take precaution. That's the best way. Just try to, of course, if anyone has a cough or anyone has a blocked nose, you should take a steam. It's not going to harm you. You can always take. But I think it's more of supportive care, more of symptomatic treatment which we get.
So as now New Year is also approaching, log generally bahar jayenge for partying and all. So any advice that you would like to give to our audience?
Yeah, first of all, I would like to wish them a very, very happy and healthy New Year through your channel.
Okay.
And I would like you to please take care. I know it's a party time. It's very difficult for me to tell them not to go to a party because, but please take care. Please take precaution. If you have any symptoms, please don't go. Remain at home. Especially with those comorbid condition, elderly people, they should stay at home.
Okay.
And anyone who's prone for infections or who I would say that going in a crowded place had a bad time in the previous COVID, please take all the precautions you can, because this is a tough time for all of us. It's a chilly weather. Many other respiratory problems are also in the air. So if not COVID, you might get other disease. We just had as China, if you remember, we had some mystery virus and all this. They had a mycoplasma and other respiratory. So there are many viruses going on this time. So please take care as much as possible.
Okay, so thank you so much for talking to us.
Thank you. It's a pleasure talking to you.